Hello learners, I Dr. Amit Tapkir from Progressive Education Society's Modern College of Pharmacy, Yamunanagar Nigadi, welcome you all for today's section. Today's section is on Antiamoebic drugs part 1. Learner objective. After watching this video, the learner will able to recall pathophysiology, clinical manifestation and life cycle of amoeba. The learner summarize peculiar features of amoeba. The learner will able to recall and summarize classification of antiamoebic drugs, and the learner will able to describe chemistry, mechanism of action, side effects, toxicity and uses of antiamoebic drugs. Antiamoebic drugs is antiamoebics. The amoeba is a protozoal infections are common among people in undeveloped tropical and subtropical countries, whether sanitary condition, hygienic practices and control of the vectors of transmission are inadequate. Protozoal diseases are thus less easily treated than the bacterial infections. Many of the antiprotozoal drugs cause serious toxic effect in the host, such as neuronal, renal tubular, intestinal and bone marrow stem cell. Antiamoebic drugs is classified as follows. The antiamoebic drugs, the first drug is a metronidazole, second is a tinidazole drugs. These two drugs comes under azole class of antiamoebic drugs. Then dioxazonide furoate, then iodine derivatives, that is a iodoquinol. The drugs from the plant origin, the examples are imetine, and the synthetic derivative of imetine is a dihydroimetine. The quinine class of anti-amoebic drugs includes chloroquine, and antibiotic class of anti-amoebic drugs are paramomycin. The amoebiasis or the amoebic infections are the type of a protozoal infection. The protozoa is a single cell animal varying in size. Some are changes their size, and some they are fixed in size. All learners, stop your video and try to find the answer of this question. What is exactly the amoebic infections? Think on this question and try to find the answer. Hope all learners are think on this amoebic infections. What is the amoebic infection? Now start the video and try to find the answer of this question with some slides. Amoebiasis, it is also called as the amoebic dysentery, is an infection of the intestinal tract caused by the Entamoeba histolytica. The disease can be acute or chronic, with the patients showing varying degree of illness from no symptoms to mild diarrhea to the fulminating dysentery. Cyst ingested through the feces, contaminated food or water, then this pass into the lumen of the intestine. Whether this cyst liberated as the tropozoites, the tropozoites then get multiplied, and they either invade or ulcerate the mucosa of the large intestine or simply feed on the intestinal bacteria. This is about the life cycle of the amoeba. Antiamoebic drugs are further classified. This is the another classification of antiamoebic drugs. The first class is a systematic classification. In this systematic classification, the drugs includes are tinidazole, chloroquine, dihydroimidine. They are effective against amoebas in the intestinal wall and liver. Second class is the luminal antiamoebic drugs. The examples are diloxanide furoate, then iodoquinol, paromomycin. This luminal type of antiamoebic drugs, they act on the parasites in the lumen of the bowel. That's why the name given as a luminal. And third is a mixed antiamoebic drugs. They act on a luminal as well as a systematic manner. The example of this mixed type of antiamoebic drugs includes metronidazole. Amoebiasis is the infection with Entamoeba histolytica. This organism can cause asymptomatic intestinal infection, mild to moderate colitis. It may cause severe intestinal infections, that is a dysentery. They may cause the amoeboma, and they sometimes causes liver abscesses. They also causes other intestinal infections. This slide will tells you about the life cycle of Entamoeba histolytica, and you will get the feel about at which area and how the drug will act on this infection. So in life cycle of Entamoeba histolytica, due to the poor sanitization or the poor lifestyle, unhealthy lifestyle, the cyst will get ingested. This cyst, after the ingestion, there is a formation of trophozoites. These trophozoites again penetrate into the intestinal cell wall. In a fourth step, they multiplied, the multiplication of trophozoites within the colon wall, and lastly they systematically invade the tissue, and lastly the cyst is discarded with the feces. In this way, the Entamoeba histolytica will grow and pass to other healthy person. About the drugs as we classified, that is systematic amoebicide. The systematic amoebicides, they will act on, they inhibits the multiplication of a trophozoite within the colonal wall, and they act systematically. The examples are chloroquine, dihydroimidine and imidine. The second is the luminal amoebicides. The name will give you a feel that these drugs acts on a lumen of gut. That's why it's called as a luminal amoebicides. Example are diloxanide furoate, paromomycin and iodoquinol. In this way, these drugs will act at different stages of life cycle of Entamoeba histolytica. Now we are going to see the drugs one by one. Firstly, we are going to see the nitroimidazole derivative. Then in that, the first drug is metronidazole. Metronidazole, you can easily find the structure of metronidazole on right hand side of slide. It's an imidazole derivative. It's not only the imidazole, it's a nitroimidazole derivative, because the nitro group at 5 position and 2 more substitution at 1 and 2nd position. At 1 position the hydroxyethyl group is present, and at 2nd position the methyl group is present. So this is about the structure and chemistry of metronidazole. Metronidazole is a nitroimidazole, is the drug of choice in the treatment of extraluminal amoebiasis. It kills trophozoites but not cyst of the E. histolytica, and effectively eradicate the intestinal and the extraintestinal tissue infection. Pharmacokinetic of metronidazole. The route of administration, you can administer this drug by oral or IV route. Both routes are available to administer this drug. Oral administration of metronidazole causes rapid absorption and penetrate all the tissue by simple diffusion method. Intracellular concentration rapidly approaches extracellular level, the peak plasma level of metronidazole reaches within 1 to 3 hours. Protein binding of metronidazole is low, that is within 10 to 20%, and the half-life of unchanged drug is 7.5 hours for metronidazole. Metronidazole and its metabolite are excreted mainly in the urine. Then mechanism of action of metronidazole. Metronidazole is inhibit the nucleic acid synthesis by forming nitroso radicals, which disturb the DNA of microbial cells, which disturb the DNA of Entamoeba histolytica. This function only occurs when metronidazole is partially reduced, and because of this reduction usually happen only in the anaerobic bacteria and protozoan, it has relatively little effects on human cell or aerobes bacteria. This is the beauty of the mechanism of action of the metronidazole. The 5-position nitro group are very important because this nitro group goes under the reduction and which binds to the DNA of the protozoa. In this fashion, the metronidazole will act very nicely as an antiamoebic drug. Clinical uses of metronidazole. Metronidazole is used in amoebiasis. Metronidazole is a drug of choice in the treatment of all tissue infection with E. histolytica. It is not reliably effective against luminal parasites, and so must be used with luminal amoebicides to ensure eradication of the infection. The dose of metronidazole is a 750 mg thrice a day and 50 mg IV infusion. This drug also used for the other protozoal infection, which includes giardiasis and trichomoniasis. It also used in an anaerobic bacterial infections. The adverse effect of metronidazole: it causes nausea, dry mouth, metallic taste in the mouth, and headache occur commonly. Infrequent adverse effect includes vomiting, diarrhea, insomnia, weakness, dizziness, stress, dysuria, dark urine, paraanesthesia, neutropenia, pancreatitis, ataxia, encephalopathy, seizure are rare. This drug IV infusion rarely causes seizure or peripheral neuropathy, but one caution is important. This drug should be used within a caution in a patient with a central nervous system diseases. And one more caution is it should be avoided in a pregnant woman due to the risk of teratogenicity, not true in a human but true in a bacteria and mice. So while administering this drug to the pregnant woman, the doctor and the patient also take care. Drug interaction of metronidazole. Metronidazole has a disulfiram-like effect, so that nausea and vomiting can occur if alcohol ingested during therapy. Disulfiram is the alcohol antagonist. It potentiates the anticoagulant effect of coumarin type of anticoagulants, and also increase the activity of phenytoin and phenobarbital. Elimination of drug cimetidine decreases the plasma clearance. Next derivative of azole class, it's tinidazole. As compared to the structure of metronidazole, the tinidazole have a very slight structural difference when compared with the metronidazole. The difference is at a first position. In a metronidazole there is an hydroxyethyl, and here the hydroxy group is replaced with the ethyl sulfoxide functional group. Tinidazole is a related nitroimidazole having a similar activity and better toxicity profile than metronidazole, and it offers similar dosing regimen. Pharmacokinetic of tinidazole. Tinidazole readily absorb and penetrate all tissue by simple diffusion. Tinidazole intracellular concentration is rapidly approach extracellular levels. The peak plasma level reaches in 1 to 3 hours. Protein binding is low, in between 10 to 20%. The half-life of tinidazole is 12 to 14 hours. The mechanism of action is similar to the metronidazole. Clinical uses of tinidazole. This drug are used for the amoebiasis. This drug are also used for the other protozoal disease like giardiasis, trichomoniasis. The adverse effect of a tinidazole is the toxicity profile is better than the metronidazole. These are some references which I used to prepare today's presentation. Thank you for listening this lecture patiently. Thank you and happy learning.